Hi, I'm Dr. Varun Malhotra. I work as a senior consultant in cornea, cataract and refractive surgery at Center for Sight, Banjara Hills, Hyderabad, and I'm also the head of clinical services. The traditional methods of vision correction were surface ablation and flap creation with excimer ablation. But now what we are moving towards, the future lies in lenticule extraction, and this technology of silk is a big leap basically in this technology. Now, how the surface ablation used to work is that we did not used to make any incision, we never used to make any flap. We used to just remove the top layer of the cornea, which is called as epithelium, and then ablate the stromal bed of the cornea with an excimer laser so as to reshape the cornea in a way that the power becomes zero. The problem with surface ablation was that sometimes post-operatively it used to leave some amount of haze. There were chances of little bit of pain in some patients, and the visual recovery used to take about 3 to 4 weeks and sometimes up to 6 to 8 weeks for the tear film level to become normal. The next method was to create a flap and do an ablation with the help of excimer laser, and this technique used to be called as LASIK and later called as femtosecond laser assisted excimer ablation or the femtosecond LASIK. In this, we used to make an incision, lift the flap of the cornea, and then the underlying stromal bed used to be treated with the excimer laser. And then this flap used to be reposited on the cornea. The major advantage over surface ablation in this was that there used to be no pain, there was no layer which was removed, so the amount of surface ablation, that is redness of the eye, used to be a little less. The visual recovery was much faster. But there used to be an incision in the cornea, there was an inherent area of weakness in the cornea, and as a result, in case of any trauma, if the patient has any major accidents, any accident to the eye, there was theoretically or a very small mathematical chance of this flap moving from its original shape. Now, with the lenticule extraction coming in, the incision became much smaller to about 2.8 to 3 millimeters, and we could go between the layers of the cornea, create a lenticule which will correspond with your refractive error, and then we remove this lenticule out of the cornea. So there is no epithelium removal, there is no flap creation, and all the disadvantages of surface ablation and flap creation were done away with. The first technique in lenticule extraction was Relax Smile. Coincidentally, Center for Sight was one of the first centers to start Relax Smile across the country and the first center in Hyderabad to start doing Relax Smile. And now we are the first hospital to start this new technology of silk in Hyderabad, which has been developed by Johnson & Johnson. Now, how the silk is different from Smile and what advantages does it bring is in the shape of the lenticule. Now, the shape of the lenticule in a silk is biconvex, whereas in Smile it used to be plano-convex. What this means is that it is very close to the original shape of the cornea. So the original shape of the cornea is retained to as much as possible. Hence, lesser amount of higher order aberrations are induced. Now, what that means in normal language is that the quality of vision and the resolution remains as similar as to a normal or a natural eye. The resolution means that the quality of the image which is formed by the eye is far superior because the shape is biconvex and not plano-convex as it was in a case of Smile. Number two, because of the biconvexity, there is least damage to the corneal nerves. And as a result, the amount of dryness, which was anyways less in the surgical technique of lenticule extraction, comes down even further. So post-operatively, patients do not experience dryness, or even if they do, it is for a very small period of 3 to 4 days. This small incision of 2.8 to 3 millimeter heals very quickly in 48 to 72 hours, and as a result, the visual recovery is much faster.
Follow Center for Sight and post your queries to get answers from the experts.